Bismillahirrahmanirrahim. The next topic of our discussion in vasculitis is Kawasaki disease. So Kawasaki disease is acute inflammation of medium to large sized as well as small sized arteries. The disease could be either acute or subacute and it is a febrile illness. Febrile illness means it is associated with fever. The disease in most cases is self-limiting and the most feared sequel of Kawasaki disease is involvement of coronary artery. The disease causes weakening of coronary artery wall, hence predisposing it to development of aneurysms. These aneurysms can either rupture or they may cause thrombosis. In either case, the outcome is myocardial infarction, and the disease is one of the major cause of coronary artery diseases in the childhood. Kawasaki disease typically occurs in children, and almost 80% of the cases occur in the age less than 4 years. The disease, although global, is more common in the Japanese population. The pathogenesis of Kawasaki disease is rather poorly understood. It occurs due to a delayed type 4 hypersensitivity response of T cells against an unknown antigen. This unknown antigen is thought to be derived from certain infections, such as Mycoplasma and HIV. So once this antigen is released into the blood, the T cells become activated and act against the antigen, hence releasing certain cytokines, causing recruitment of polyclonal B lymphocytes and macrophages. The B lymphocytes secrete antibodies against the endothelium and smooth muscle cells of blood vessels, causing damage to blood vessel wall, hence resulting in vasculitis or Kawasaki disease. The histological features of Kawasaki disease resemble polyarthritis nodosa, hence it is also known as infantile form of polyarthritis nodosa. The histological picture reveals transmural inflammation of arteries. Transmural means involving full thickness of blood vessel wall. The inflammatory cells are most commonly macrophages, lymphocytes, and neutrophils. Unlike polyarthritis nodosa, where fibrinoid necrosis is extensive, the Kawasaki disease is characterized by minimal fibrinoid necrosis, and the fibrinoid necrosis is not as much developed as in polyarthritis nodosa. There is also damage to endothelium and intimal hyperplasia, and there is necrosis of tunica media due to the antibodies against smooth muscle cells. The loss of smooth muscle cells result in weakening of blood vessel wall, which predisposes the arteries to develop aneurysms. This aneurysm can either rupture, causing hemorrhage, or it may cause thrombosis within the arterial wall. A fully healed lesion of Kawasaki disease is characterized by a thick wall of the blood vessel and a narrow lumen. The wall thickening is due to fibrosis of the inflamed area. Kawasaki disease most commonly occurs in the children, and almost 80% of cases are occurring in age less than 4 years. The disease is characterized by presence of fever and generalized rash. The rash is of desquamating nature. Desquamating means the keratinized squamous epithelium of the skin is shed off in the rash. Moreover, there is also conjunctival and oral erythema, and in severe cases, conjunctival and oral erosions are also present. There is also swelling of hands and feet due to edema, and there is erythema or redness of palms and soles. Lymphadenopathy is also a feature of Kawasaki disease, characterized by enlargement of cervical node. The disease, although self-limiting, but in almost 20% of untreated patients, cardiac complications can develop, which range from asymptomatic to which include aneurysm, myocardial infarction, and in many cases, pericarditis and myocarditis can also occur. The diagnosis is established on clinical features of the disease and angiography, which reveals formation of multiple aneurysms in the coronary artery. The treatment is with aspirin and gamma globulins. One thing to remember here is that Kawasaki disease is one of the major causes of cardiac complications in children. So this brings us to the end of discussion about Kawasaki disease. If you have any questions, do let us know in the comment section. Thank you.